everyone. Welcome to another Shop Talk. My name's Chad Cook, and today we have Dr. Damian Keter. And he will be talking about a recent paper published in 2023 from the Journal of Educational Evaluation for Health Professionals. The title of the paper is Priorities and Updating Training Paradigms in Orthopedic Manual Therapy, an International Delphi Study. So Dr. Keter, or Damian, wonderful to have you on. Please, do you mind telling our listeners a little bit about yourself and your research background?
Yeah, absolutely. First and foremost, thank you for having me on today. I'm really excited to be here talking to you, Chad. I am a physical therapist at the Cleveland, United States Department of Veteran Affairs Medical Center. I work primarily as a clinician. I also am a lecturer and educator here at our facility, as well as nationally for their pain mentoring program. And then I perform research looking at topics related to manual therapy and how really person-centered aspects, patient-centered aspects influence manual therapy outcomes themselves. I completed a little background on my education. I completed my DPT, my physical therapy degree in 2013, and then more recently went on to complete my PhD degree under Chad Cook, Dr. Kenneth Learman, and Dr. Dave Griswold out of Youngstown State University. And I completed that in 2023. And this project that we're going to talk about, this publication, was part of that dissertation process and really looked at, again, tying in how do we look at manual therapy through this realm of focusing on the patient, getting away from just focusing on the technique and some of those things. So from a personal standpoint, I have a wife and two young children, so most of my time is spent with them these days. It is still snowing here at the end of March in Ohio, so we had the opportunity to do anything outdoors, but that's usually from a personal standpoint, that's usually where we end up spending most of our time and most of our weekends with the little ones. But that's pretty much me in a nutshell.
And don't you teach manual therapy sometimes too? Am I correct with that?
I do at our facility here, as well as a lot of the neurophysiology of it here at our facility and nationally when we do some of the pain mentoring at other facilities.
So let's talk about why you decided to, and I know this was part of your dissertation, but the genesis of this, I believe, was your idea. So what made you want to tackle this idea of looking at a consensus-based project on updating training paradigms? Where did that come from?
Yeah, so that's a great question. It has a decent history behind it. When I came out of physical therapy school and I started taking continuing education courses, there's kind of two worlds that I traveled along. There was a lot of the pain science, pain neurophysiology stuff, and a lot of the manual therapy stuff. And in my mind at the time, as I was going through these CEUs, these things worked very well together. And as I went through a lot of these manual therapy courses, I can't even count at this time how many courses I ended up going through, early on in my career. But I started seeing a little bit of a disconnect, and I started seeing this variability in how some of these things were taught. And there was one moment in this course, in one of these courses I took, that I remember really taking a step back and saying, this just doesn't seem right. And I was at a course, I'm not going to say which group it was through, but I was at a course, excellent course, great instructor. And we were spending a lot of time focusing on the very specifics of these techniques. Your elbow has to be this way at this degrees. It had to be applied, the force had to be applied this direction. And this is how they perform the techniques. Was the norm for this group. And then we took a break for lunch, and directly after lunch we started talking about pain science and pain neurophysiology and how patient expectations influence outcomes, and how us looking at that within session response and between session response was really important for us to understand if this was the right technique for the patient. And it was kind of counterproductive to this idea of, well, you told me if I go at this angle, this is the right technique for this patient based on what I'm seeing during the exam. But yet you're also backpedaling and saying a bit that it's not as simple as that. So a lot of this confusion, I think, in my mind, aligned along several of these different courses that seemed like they were trying to pull some of the more modern, quote unquote, theories, while also still hanging on to some of these more biomechanical, arthrokinematic, osteokinematic theories that a lot of the manual therapy historically is based on. And so, as going through this, coming up through this training, I really wanted to know more about why we were training the way we were and how to move forward with our training in manual therapy. We know that since then, there's been a number of publications looking at manual therapy and this idea of it's being demonized for some of these ideas, these historical ideas that some of these philosophies are still teaching based on. And so we know we need to update things. Will Cole did a beautiful publication in 2020 where he looked at this idea that we need to update how we teach manual therapy. And so, the call was already there. I think I just wanted to do a study to really put some of these pieces together and get consensus on how does this look moving forward.
That's a great background. The you used a Delphi study, which is a consensus-based study. Do you mind just briefly giving us a background on what a Delphi is?
Yeah, absolutely. So as you said, it's a Delphi-based study. It's a form of mixed method research, which has a lot of positive values to it because it includes some of the qualitative components as well as putting some quantitative stats on those components. So it's a three-round type of questionnaire. The first round, or the three-type round, survey per se. The first round being open-ended, asking some open-ended questions to the respondents. The second and third round being voting on some of those responses we got to that first round from the same respondents. It's a beneficial type of consensus research for things like gaining gaps in research and priorities in research and looking at kind of where we're going to move going forward with things, target concepts for things, especially as it comes to medical education. So that's why I wanted to utilize this for this type of study.
Yeah, super. So typically, in a Delphi, you anchor a concept. And in this case, you used orthopedic manual physical therapy. Did you standardize that or did you define it for the Delphi participants initially?
We attempted to, and so this is an area, I think there was a lot of variability here, and when you look at how manual therapy itself is defined, it depends. I always tell people it depends on who you ask, because some looked at it as more of a technique, some looked at it as a training concept. Obviously, depending on the different philosophy you were trained under, you're going to view this very differently, and so my opinion, I've always viewed orthopedic manual physical therapy as more of a philosophy in which you attempt to identify individuals with those hands-on interventions may be useful for, and then utilizing those in a skillful manner through those different trainings you may have received to get that patient better in front of you. Really, again, focusing on the patient in front of you. More recently, as you know, because I believe you were one of the authors on this, Chad, Dr. Jason Silvernail has put a publication out in Physical Therapy Journal just the past couple of weeks, which has looked to define orthopedic manual physical therapy. And it's really done beautifully tying together this definition of this so that we have a more concrete definition of this. So while I attempted to do this for the study and I outlined them, how we were viewing this, there wasn't at the time a concrete definition of orthopedic manual physical therapy.
Okay. So I think you invited well over 100 individuals from different manual therapy organizations around the world. Did you get in that first round, it's an open questionnaire of areas that they make suggestions of what should be kept and what should be removed. Did you get a lot of variability in that first round on suggestions?
Yes, yes, and it was really interesting seeing some of the responses and there was significant variability. We actually had a lot more individuals from the United States than anywhere else completed. So I can't say necessarily that we saw regional differences or geographical differences, but there was a couple concepts that were actually included both in, and I'm assuming we'll talk about some of the questions we utilized here in a minute, but there was a couple concepts that were actually included in opposite ends of the spectrum related to things to focus on and things to omit. And so it was really interesting seeing some of the variability. And I'm assuming some of that variability stems from the different training philosophies and how these individuals were trained and perhaps when these individuals were trained as well, because we know things have changed over time. But yeah, a lot of variability between the respondents.
Do you have any examples that you can give off the top of your head?
Yeah, absolutely. The two that really stuck out to me the most is pain science was included as a concept to look at omitting from manual therapy education, as well as pain science being a concept that they said should be focused on within manual therapy education. Another thing that fell on both ends of those was looking at biomechanical principles. This also fell in both, where there was actually individuals that felt that biomechanical principles should be omitted from focus in manual therapy education, and other individuals that felt that this should be focused on within manual therapy education. So there was those are the two that stood out to me the most as being interesting, to say the least, that there were individuals on both ends of the spectrum with these.
Yeah, that's super interesting. That I guess, and we're going to talk about what actually reached consensus here in a minute. But do you mind defining how you determine consensus? And you actually had several layers of consensus, I think, in your paper. But do you mind telling us a little bit about that?
Yeah, absolutely, absolutely. So we used 75% as the consensus threshold. So that's saying 75% agreement on either agreeing or disagreeing with a concept. Since that time, the Accord, the Accurate Consensus Reporting Document guidelines have came out and they've recommended 80%. These came out after we had already went through IRB approval and started the process of this. So we had discussed this and we decided to leave it at 75%, which is still acceptable for this type of research. When we looked back to see if it would have changed anything if we bumped to 80, it wouldn't have. So it didn't really matter much for our study. But we utilized that for full consensus. And then we said anything between 60 and 75% was near consensus. So it was one of these things of, we still saw things trending in this direction of either agreeing or disagreeing with it, but it wasn't quite all the way there. And so that's how we defined the consensus and near consensus in our study. Anything else lower than that was just undecided, no consensus.
So I've done a few of these myself, and we typically have, 75 to 80% of the material, everybody meets consensus, and there are only a few things where people don't reach consensus. That's not what you found in your paper. About half, it seemed, met consensus and about half did not. Tell us a little bit about the themes that met consensus in your study.
Yeah, this is where things got really interesting. There was three major questions that we focused on in this study. The first was, I would recommend manual therapy training focuses on. The second being, I would recommend manual therapy training omit focus on. And the third question, the foundational knowledge I feel necessary to apply manual therapy is. So when it came to that first question, I would recommend manual therapy training focus on. We identified 25 themes throughout the respondents of things they thought that manual therapy should focus on. All 25 of those themes met consensus on things to
Wow.
include. And so there was a lot of support for, factors across these biomechanical domains, neurophysiological domains. The most support was for patient factors, including patient comfort, patient handling, communication, managing patient expectations. But there was also support for a lot of the biomechanical factors, grading mobilization, localization of tissue dysfunction, using of OMT for soft tissue dysfunction, motor control, education across neurophysiological, psychological, and biomechanical principles all met consensus as well. So you can see there's a really broad umbrella as far as things that people think should be included in manual therapy education. What was really interesting with this is we identified 19 themes of things people thought should be omitted from manual therapy education. And of those, only one thing met consensus, and that was visceral manipulation. And
Wow.
so what I got out of these results is it's saying that people think manual therapy educators, because that's who we included in this as experts, okay? Manual therapy educators think that there's a lot of stuff that needs to be included and not much that needs to be omitted. It kind of speaks to the breadth of knowledge that individuals feel are included in manual therapy practice.
Okay, that's super interesting. Knowing Jason Silvernail's recent paper, which provides almost an active definition, I think, of what orthopedic manual therapy is. Do you see strong overlap with your Delphi findings and his definition?
Absolutely. Absolutely. When I read his paper, it made perfect sense to me because it aligns with what these manual therapy educators already feel. Okay, it's more than just applying a technique. When you look at the things that were most supported in this study, again, this patient comfort, patient handling, communication, educating the patient, okay, coaching the patient beyond the hands-on technique, following up with exercise and education and all of these other things. It's not just the hands-on stuff. Okay, we don't have magic hands, right? We know that that's a component, but there's a lot more to it in orthopedic manual therapy education. And we know that. Anyone who's gone to, these educational courses know that you don't just focus on techniques the whole time. We know that there's a lot of theory and it's a lot of how the clinical reasoning of how and when to apply these techniques. And I think Jason did really well tying that into his paper, and it aligns very well with the findings of this study.
That's awesome. Hopefully we can get him on here and have him talk a little bit about his paper.
Yeah.
So way back in the early 2000s, Tim Flynn and colleagues published a paper called Manual Therapy, We Speak Gibberish. And basically it discussed the fact that there are a lot of terminology issues. Did you encounter that at all in your Delphi study where potentially the terminology used was one of the reasons why something didn't meet consensus?
It I don't necessarily know if the terminology was a problem in things reaching consensus or not. I think the what falls under the different umbrellas may have been more of the issue. When you talk about things like, even when we look at some of these things that we're disagreeing, when you talk about things like pain science, right? That term to me is the understanding of pain as it influences, the mechanisms contributing to it, the mechanisms that contribute to analgesia, and those type of things. Unfortunately, some individuals that don't have that same understanding of it might see pain science and say that means pain neuroscience education. Okay, that's that umbrella. And because of that, I think there may have been some terms which people didn't understand what may have fallen under those. And that's one of the complications when you look at these type of studies with the open-ended questioning. Do we really know as researchers what the individual meant in their response as well? Okay. So I think that makes it a little bit confusing, for some of those concepts. But I think overall, it seemed like the things that were supported and not supported were relatively clear to the individuals.
So you mentioned you teach manual therapy. How has your study changed how you communicate with learners in manual therapy, or has it not?
I think from my standpoint, I've already educated in this manner because I have already felt this way about therapy. I think what this does for me is allow me to have some research to support that and to support, okay, we need to spend some time talking about how you communicate these techniques for a patient. Why? Because this is one of the things that's important for manual therapy education. Okay, we need to focus a little bit on patient comfort. We need to focus a little bit on, safety, some of these concepts, and maybe not spend the whole time focusing just on the techniques. Yes, these techniques are important. We know they're important, but perhaps our focus throughout this educational, content should be on all of these aspects rather than just that technique, rather than just the hands and the spine. Let's take it a step back and focus on the two individuals in the room.
What would you say to naysayers out there, the anti-manual therapy crowd that believes that manual therapists are teaching things that are not pertinent or incorrect or invalid? I mean, did you see that in the Delphi?
Yeah, I think, we didn't see, the individuals we reached out to in this were individuals who are teaching and practicing manual therapy. So we didn't get so much naysayers directly in this study. Now we know those individuals exist, right? We all know those individuals exist out there. And I think it's important for us to realize manual therapy works, right? It's in clinical practice guide. I mean, at this point, if you don't understand the value of hands-on techniques, you're not looking, because we see these things pretty clearly across clinical practice guidelines, even when you look at the more recent World Health Organization's low back pain guidelines, right? Even these high-level guidelines, these things are there. And so the question isn't, does manual therapy work or not? We know it works. The question becomes, are there individuals that are teaching these things in a way that isn't appropriate? And I would say there probably are. I would guess there probably are some individuals that are still teaching based on outdated models. Are there probably individuals who are teaching exercise based on outdated models still? Probably, right? Are there individuals that are still doing a lot of things in healthcare in improper ways based on how things were taught 20, 30 years ago? Probably, right? We know everyone doesn't adjust to the times. And so I can't say that everyone across manual therapy education has adapted to times changing in our understanding of things. But I would like to think the majority has. And this study really does well outlining that the majority has adapted to changes and improved understanding of things. And really the findings from this study align with current best evidence on what should be focused on and what is important. So I would say the majority here has spoken and said the majority aligns with current best evidence on.
So I think one of your first papers, you did an editorial where you made a recommendation that there needs to be effort invested into understanding the mechanisms of manual therapy, and mechanisms are essentially how the treatment actually works. So is it does it affect inflammation? Is it pain modulatory, et cetera? With respect to that, did you find anything in the Delphi that supported your suggestion about continuing efforts and mechanisms?
Absolutely. Absolutely. One of the things that met consensus for to focus on in manual therapy education was education to the learner, so to the fellow or participant in the continuing education course, whatever it may be, on three levels of mechanisms: the psychological mechanisms, the neurophysiological mechanisms, and the biomechanical mechanisms that are occurring with manual therapy. Well, that's a bit of a problem because we don't know all of these things yet, right? We're still trying to fill a lot of these gaps here. And we did a nominal group technique where we tried to outline some of these gaps for Journal of Manipulative Therapy earlier this year because we know there's a lot of holes there. A lot of these areas we say, okay, we know that this occurs when you put your hands on patients, but we don't know how relevant it is or how this interacts with other factors or other mechanisms. And so there's definitely support there for us to understand these things and appreciate them. But I think there is still a need to understand these things overall a little bit better.
Yeah, so do I. Um, with respect to when the paper came out and since then, what has been the response of individuals who've read this work? What has been the communication that they've had with you?
Has anyone read this yet? It says one person has read it. Is that you, Chad? I'm just kidding. I'm just kidding. So, most of the individuals that I surround myself with, I would like to think are individuals who have kept up with the evidence really well on their own. And so most of the individuals who, I work with who have read this say, makes sense. Makes sense. This is where we were already thinking things were going, and they're not surprised to see these things because when you talk to people who are, fellowship trained or advanced trained in manual therapy, a lot of them are very keen on keeping up with evidence as it evolves. And so I think even though this hasn't been written previously as consensus, a lot of individuals have already been trending this way. And so most of the individuals who I talked to about this were very accepting to it and had, we're in complete agreement that it makes sense for our profession, to start moving this way with manual therapy application.
Anything that really surprised you about this study or anything you would do different?
I think one of the surprising factors to me was how we identified individuals for this study is we utilized the IFOMP database and their associated member databases to identify educators in the different fellowship programs. And I was actually shocked to see how many of the programs had none of their faculty members listed, no contact information for any of their faculty members. And it was a bit disheartening because I would have liked to see more national rep or international representation. And obviously the way we had written it to find participants didn't really get us there. And so it was a bit surprising. And I would like to see more transparency there from some of these programs so that individuals can reach out to them with questions. And, even program directors of some of these programs, there was no contact information for directly through their IFOM website, and so I think that there's definitely that was a bit surprising to me there. Other than that, I think the findings, like I said, of this, there was no findings specifically from the study as far as the consensus is that we found. There was no direct findings from that were shocking to me. I think it all kind of just supported the way I felt about things in relation to, where we need to go moving forward, which was it was nice. It made me feel at least validated to some degree that I might know a thing or two.
It also makes me feel that a lot of people are thinking the same way about moving us in a more modern direction. And that was my takeaway from the paper too. So you were very productive on your PhD, and you've always got something brewing. Um, tell the listeners what you have going on right now. What's your
How,
next project?
so the one of the current larger projects we're working on is we're doing a umbrella review, which is a review of reviews. identifying the mechanisms of manual therapy. So kind of touching on what we briefly talked about a few moments ago, trying to really map out what's happening. From some of these systematic reviews, meta-analyses, trying to map out what's happening in these different systems of the body when you put your hands on individuals. I think there's still going to be a lot of gaps there. I think it's going to be a framework, but I think there's going to be a lot of gaps kind of stemming off of that as well. I also have a couple side projects that are just interesting to me, looking at some things like social media content and some of the stuff we see there, because we know there's a wee bit of a problem there on some of the content we see in social media and the quality of it. And then I also have my hand in a couple different pain education projects that we're looking at within the VA and elsewhere, where we're trying to identify, what people know about pain and what their understanding of pain is, because I think that directly aligns how we address it and how we treat it with some of these interventions like manual therapy.
Awesome. Damian, thanks for being on Shop Talk, and thanks for the work you do in moving manual therapy forward. And I'd like to also thanks the listeners. I think there's our 23rd podcast on Shop Talk. Thanks, folks. We'll see you in the next one.